training curriculum to meet that need. We then outreach to the community, bring in children, youths, and provide a 300-hour training program, 150 of which is soft skills training, 150 of which is industry-specific training to meet those needs. The program currently operates in 8 states: Punjab, Rajasthan, Gujarat, Bihar, Jharkhand, and Chhattisgarh, West Bengal, and also Delhi NCR. This program has reached 48,000 young people, and here's the kicker. It's not just about training them, it's about placing them in jobs. Our placement rate to date has been 77%. That's some real numbers, and it's something that we're very proud of. And it's what it equates to is about a 3-fold increase in their monthly incomes. And perhaps one of the other exciting things about this program is that, you know, the development sector has often left women and girls behind. 61% of participants in our MUST program are girls, and 43% of those placed are girls. Our goal is by 2012 to reach 100,000 young people, and the average cost per trainee, depending on the track, is $65 to $120, so it's a relatively low cost intervention. I said before that AIF does have a microcredit program. We work with rickshaw drivers in several states in the north. There's 8 million rickshaw drivers throughout India. We're talking pedicab rickshaws, average family size of 5. These largely migrant communities aren't able to access the formal credit sector. So AIF works with our partners, providing the $250 loan so that over a period of 16 to 18 months they can own their own rickshaw. And then in addition to that, we have several other interventions such as licensing, ID cards, uniforms, supplemental marketing schemes, and so forth, that both get at some of the societal issues, raise their status in society, raise their credibility and status relative to the police and municipal corporations, etc. And it's really been a life-changing intervention for them. Roughly trebles their annual income. And the way that we do that is through providing first loss default guarantee. So even though we are helping pay for or providing this credit, it's actually the banks. We work with 6 state banks, and we provide a first loss default guarantee. It allows us to leverage our resources 10 to 1. Finally, and there are several youngish people in the room, so this is maybe of particular interest to you all. As I said, President Clinton serves as chair of AIF's Board of Trustees, and in honor of him and his commitment to India and his commitment to citizen service, we've named the AIF Clinton Fellowship for Service in India after him. I describe this a bit tongue-in-cheek as Peace Corps on steroids. It's just an easy way to think of it. That said, it is a 10-month service opportunity for young people. We place them with an Indian NGO, and it's really about capacity building for that NGO. These are, let me put it to you this way, 70% of the people that we send, and we've sent 315 over the last 9 years, so we send a class of about 25 per year. 70% of them already have a postgraduate degree or significant professional experience. And one of the exciting things is that, look, even the most well-resourced NGO in India, it's unlikely that they're going to have access to a Harvard MBA to help them develop a new financial management program, or a highly trained PhD in public health to help them develop and deliver programs. This is what we provide. Very selective. We have about a 1 in 7 selection rate, and it's a program that is of great value both to the fellows who participate as well as to the NGOs that they serve. Finally, public health. We don't currently have a signature program in that. We started out in the HIV and AIDS space. We got out of that several years back when we concluded our grant with the Bill and Melinda Gates Foundation, and are now undertaking a pilot program in Jharkhand in partnership with the Tata Rural Steel Development Society. It's a maternal and child health program. So let me, she's sitting here, she's ready to go with her thing. Got it. Let me just leave you with one thing to think about. And I'm so pleased to be here today. One of the things that this group can do is look for opportunities for collaboration. It's something that we talk about all the time, and it's something that we as a sector do really, really, really poorly. And the reason is, and I challenge you all, and I challenge us as well, we all have a vested interest and have put so much time and effort into our various initiatives and programs and organizations. And yet if we think very hard, and we really think about what it is that we're trying to accomplish, we're all here because we want to serve other people. And there's opportunities for collaboration. There may be opportunities for merger. My point is that we need to keep that beneficiary in mind before ourselves. So, thank you so much. Is that there are opportunities on a programmatic basis to assist one another. One thing that I take very seriously, and hopefully some people who are in the room who have worked with me in the past will attest to this, if a donor comes to me and says, I'm really interested in education in, educating children with disabilities in Orissa, I can help you with part of that. So I have a choice. I can either say, sure, I can do that, and we can, figure out how to meet that need. Or I can say, you know what, that's just out of my sweet spot, just enough so that it makes much more sense for me to connect you to somebody who does that really well. So there's multiple kinds of collaboration. There's informal collaboration that is as simple as connecting people to one another, and we do that every day. And then there's formal collaboration that ends up in MOUs and joint funding agreements and so forth, and that's a little bit more complex. And then there's, literally bringing all organizations under one roof, which is yet a whole other ball of wax that I think, at least at that time, wasn't something that they were interested in. So my point is that there's a lot of different ways that this can be undertaken, and it's a direction that we're trying to move ourselves in. That said, one of the things that I've noticed is that, and I always try to explain to my American friends who aren't of Indian origin, that you have to think of India much more like you think of Europe, really. People think of themselves as Bihari or Gujarati or whatever before they think of themselves as Indian. And that, from an individual funding perspective, is one of our greatest challenges, because people want to deploy their resources to their home state. Okay, that's fine. The problem is that our corporate donors, they all want to allocate their resources proximate to their factories or their offices or whatever. So we're meeting both of those needs. The only really flexible money out there is the larger private foundations. And that's, of course, especially for smaller organizations, the hardest money to get. So a role that we can play and would be very interested in playing is, especially for the organizations that are focused on a state-by-state basis, there may be opportunities for collaboration there where we can help organizations leverage their money farther. And a lot of the grassroots organizations or state-based organizations that we interface with here at ICC have been in existence for far longer. So, I think the learning can flow in both directions, is my point.